Good morning, everyone. We're going to give it just another 5 minutes or so. We'll start at 11 o'clock. Just want to make sure we have time for any last minute people getting on here. Appreciate you waiting, and we'll be with you soon. Again, good morning, everybody. Thank you for joining us. We're going to give it one more minute for some last minute people to jump on here. Thank you. Good morning, everybody. Just wanted to thank you all for joining us this morning. Again, we are Pinnacle Financial Services, your FMO, your IMO. We deal with senior market and work with all independent agents and agencies around the country for Medicare supplements, Advantage, life annuities, final expense, and some few other products. I want to thank everybody for coming today. We're going to be going over some D-SNP selling opportunities and just kind of a basic program with it. We're going to dive into some of the basics of it, and then we can't cover every single little in and out of dual opportunities, but we wanted to give you a basic webinar here, and contact any of your sales directors for any other full details for your area. Just some housekeeping stuff. You will be on mute. We will have a question bar as well too, if you'd like to ask any questions or reach out to one of your sales directors. My name is Dustin Sharrock, and I'm joined here by Cody Johnson and James Norton as well. So we're going to be going over our agenda here for D-SNP, year-round selling opportunities. As we know, the dual market can be sold year-round. There's a big change that happened this year versus last year. Last year you could enroll somebody every month. Now it is once a quarter, but there's still plenty of selling opportunities year-round for that. Creating special election periods, SEPs, as you may know, low income subsidy, LIS or extra help, Medicare saving programs, state pharmaceutical assistant programs as well, dual eligible plans, lead generations, and commissions. That's what we're going to kind of be going over today as well too. Okay, year-round selling opportunities. Obviously, you have agents, you have your special election periods, which we're going over, and group terminations, retirees, some other options with senior health products, hospital indemnity, cancer, heart attack, and stroke, short-term care, and final expense. Did you know some statistics and analytics for dual eligibles? Out of approximately 9 million duals nationally, only 11% are enrolled in a D-SNP health plan. And these, analytics are going to be from 2018. We'll get updated ones as well. 40% of dual eligibles are under 65. 44% of dual eligibles are non-white minorities. 62% are female. 58% of dual eligibles live below the federal poverty limit. And we're going to gear into some low income subsidy, LIS, or extra help, if you will. Basically what this does, it's a category that provides assistance with Part D premiums, their deductibles, and co-insurance or co-pays. The way you apply for that is through the Social Security Administration directly. Dependent on both income levels, these are going to be 2018 levels. Single less than 18,090, and married less than 24,360. Valid complete applications are usually processed within 10 to 14 days. So that's usually the standard process for it. They need to check and verify their eligibility. In order to utilize the LIS award, they must be enrolled in an MA plan or standalone PDP. So that's a key right there. They do have to be, enrolled in an MA plan or PDP. So Social Security Administration does not count the following items as income. So this is something to keep in mind as well too. We get a lot of questions with agents calling in, and does this apply? Does that apply? Food stamp assistance? No. Housing assistance? No. Home energy assistance? Medical treatment and drugs? Disaster assistance? Earned income, tax credit payments, assistance from others to pay your household expenses, victims, compensation payments, and scholarships and education grants. Medicare saving programs is another form of it. Limited income and assets may qualify prospects for MSP, medical savings programs. Qualified Medicare beneficiary, specified low-income beneficiary, and qualified individual and additional low-income beneficiary. Federal-state partnerships helps with Part A plus or Part B premiums, available in 50 states plus the Washington, D.C. area. Moving into the SNP Consumer, these are just some analytics here. You can take a look at some of that. 18% of Medicaid enrollment, but 40% or 46% of Medicaid spending. You have the dual SNP and the chronic. You can see that a lot of the dual eligible and the chronic, they will overlap. A lot of dual eligibles, not all, but a lot of them are likely to be chronically ill. 3 in 5 dual eligibles have multiple chronic physical conditions as well too. So that's something. There's a lot of crossover in that market. Dual special need plans are also known as D-SNP. Enrollment open to duals, again, year-round. They can enroll once per quarter. So you have 4 opportunities to switch somebody, on a calendar date for a year. To provide additional services, traditional Medicaid might not cover transportation services, monthly allowance for over-the-counter items, gym memberships, dental, hearing, and vision. Includes medical and prescription drug coverage, and coordinates with Medicaid to provide plan with little or no out-of-pocket cost. Basically, kind of overview on what dual SNP plans are. Income eligibility for Medicaid in Virginia. This is a statistic from last year on average, and again, we just use an example for Virginia. The household size, you can see one maximum income level is going to be $15,800. Household 2, $21,307. Household size with 3 people, $26,813, and a family with 4, $32,319. They are just some, examples just to give you for income eligibility for Medicaid in Virginia. So with that being said, I'm going to turn it over to James Norton now. He's going to continue some of the presentation.
Yeah, thanks, Dusty. My name's James Norton. We were on a webinar yesterday. If some of you were on that as well, I handle some of our different territories than Dustin does. For example, like Dusty was saying, this is an example of Virginia. I threw it up there. I actually used it in our meetings, Pinnacle meetings we did this past year. Basically, if the income levels are below this for the household size, then they possibly could get on a dual SNP product or qualify for that. Now moving forward, sorry, I just hit the wrong button. There we go. All right, sorry about that. So some of the sales support tools that you have now, we understand when kind of trying to get into the dual SNP market, and you're trying to understand everything, and it's a little bit harder. Maybe it definitely is a little bit harder than Medicare Advantage, where it's during AEP, and you just write them on a case, they'll get through. You don't have to worry about eligibility or anything like that. So we understand it can get a little bit confusing, and a lot of the different states have different rules. For example, we had Virginia up there. Some of their qualifications and their dual SNP changed last year, and it is a little bit more complicated as well. But a lot of these carriers who offer products, dual SNP products in the different territories, will have tools to help you out with that. As you can see, there's a lot of these carriers will have a national dual SNP sales team, and they'll have market-specific sales team. So, for example, you might have a United Healthcare or Aetna rep or Humana rep that you deal with and knows everything about the Medicare Advantage products. But then also, they might have someone who specializes directly in dual SNP. Not that your rep doesn't know anything about those products; they usually do. But the dual SNP market rep usually kind of knows the ins and outs of that market. Now, as you can see, there's direct mail, Medicaid lead list, toolkits. We'll get into that a little bit. I'm going to go over some leads, so you can kind of understand the dual SNP products. And then also, if you guys are attending any of the trainings, I know I talked to a couple of my agents. I think they're at the Virginia training. There was ones in Louisiana. Those are some of my states. I'm pretty sure they were nationwide. But they did some trainings throughout the country, really, and they're really just trying to push the SEP business. And then even people, the carrier reps are trying to hit their numbers. They want to have some 1/1 effective dates, so they were getting some training for that as well. But as Dusty was mentioning, you can write these year round, but like he was saying also, you can only write them once a quarter now. So I know a lot of times when I try getting agents to do this, instead of trying to target turn 65 leads, which every agent under the sun is doing, a lot of times they're worried that they'll write them 1 month and they'll change the next plan. Even before this rule changed, that really wasn't the case, because there wasn't, maybe in certain areas you would have this, but in most of my states, we would have about maybe 2 or 3 dual SNP plans, and there's only 1 or 2 that would really be the best. So depending on network, once you get them that plan, and as long as you kind of stay in their face, and we're going to show you how to do that in a little bit here, you should be able to keep them on your books, no problem. And then with the change, with writing them once a quarter, I think that became a little bit easier again this year. Another tool here down at the bottom, the dual SNP support tools. This is United Healthcare specific. This is their name for it. I know Aetna does it as well, but it's Producer Help Desk Medicaid Eligibility /verification. So what that is actually there's a phone number, and we'll get to this in a little bit, where you call and you can actually, if you have a client that you think you might be able to write on a dual SNP, their income levels are below the amounts that you saw before, depending on which state. I mean, those were only for Virginia. They do change state to state. You can actually call Producer Help Desk, and you can ask them, okay, here's the client's information, and give all the facts, all their assets, and see if they actually do qualify. And just because their income's below that amount doesn't mean they will definitely get in or qualify as what they call a full dual, where you get on the dual SNP products. And that's because you have to look at their assets and some of the other things. And we're actually going to have a walkthrough on benefitscheckup.org with Cody here, and he's going to show you how you can enter in all that information and see, and how that kind of comes into play on the different programs they might qualify for, in addition to some of the Medicaid eligibility. So here's the phone number that we were talking about. If you want to write this down, you can. Or, of course, we have all those numbers at our desk, so we can help you out with this. But this is the Medicaid verification line, so this is for United Healthcare. You do have to be appointed, because they're going to ask for your writing number. So don't expect just to not be appointed with United Healthcare and be able to call up and get these information. So you do have to be appointed first, have your agent writing number handy, and then, like I said, you can give them all your clients' information, and they can confirm if they're already on a certain level of Medicaid. They're not going to be able to tell you if they qualify for it. They might say they might, they might say, well, I think they will, but they're not going to be able to tell you definite or not. That's where you have to do it through the SSA, or Social Security Administration. So as you can see here, everything else. So they'll do a three-way call with the consumer. So if you're not in the house, they'll get on the phone with your client. Agent data, obviously you have to do your writing number and confirm that you're certified. So dual SNP products, you do have to do an extra certification for. It's kind of like if you're just doing PDPs and you want to start doing MAs, you have to do the MA certification. Same thing here with the dual SNP products. And then their UHC agent toolkit. A lot of the carriers, again, all have different ones. I actually grabbed some of these slides because in most of my territories, I think United Healthcare has majority of the dual SNP business, but there is some states where I do have Humana, Aetna, but I would say United Healthcare, through and through, usually has product in each state. But again, going here, UHC Agent Toolkit, you get community meetings, electronic presentations, some other things to get your names out there, and we have some documents of those. I'll show you in a little bit. But other keys to selling dual SNPs is to thoroughly understand the local Medicaid plan and how the dual SNP plan works with it. So again, in each state, this is going to be different. There's going to be a different name for whatever the Medicaid program is. Like I was kind of mentioning, Virginia, they changed up their rules. You have to do your certification and somehow or how the Medicaid works with the CCC, they call it. Second thing is knowledge of the provider network. Just because it's dual SNP doesn't mean every single provider takes them. And it will be different from the Medicare Advantage plan. So I do know certain areas where United Healthcare isn't a network, but their dual SNP plan is, or vice versa. So just make sure that you do, and you're doing your provider lookups as well. And then if any of you were on the webinar yesterday, we briefly talked about our online enrollment system, the Connect for Medicare. If you're using that, and you can use that for dual SNP products as well, you can do a provider lookup right from that platform. So you don't have to do anything special. Look up a dual SNP, what networks are in the dual SNP plan. And lastly here is understanding the beneficiaries, prescription drugs, diabetic supplies, and durable medical equipment. So I mean, just going in hand with that is really, you have to understand, obviously, if you're selling the plan, you understand the benefits and everything. Dusty was showing you a little bit earlier with, there's a different dental vision hearing, you have the transportation, things like that. And we're going to get into the thank you letters and following up after writing the case. But you want to make sure that the client's always accessing those benefits, because a lot of times, someone will write someone on the case, and it's great. They hear about all these benefits at first, but if they're not getting back, and if they're not involved with the carrier and getting those benefits, they're going to think that the plan's not that good, and they're actually going to disenroll themselves. I've seen it happen a lot of times. So Agent Toolkit is how you get some of these materials. So the physician's health choice, preferred care partner, United Healthcare Dual Complete is where you're going to go. This is all the options on the Agent Toolkit, and you'll be able to pull up information like the dual flyers, dual ad with benefits. Again, it'll list up here. It'll be listing. You can't really see it because it's not blown up. We want to just see all the options. It'll say what benefits you get in that area. Like I said, it's usually dental, vision, hearing. It'll be transportation, riders, things like that. And then again, here's some more posters, pharmacy leave behind, plan pocket folder. And then here's some more flyers that are blown up for you. These are some of the things that you can hang up in different areas. Again, you can get your agent name and number on there. And then some of these other carriers have this as well. Like I said, I just already had this presentation with some of the United Healthcare stuff that we did with one of our reps in the States. But again, see, transportation, large provider network, no referrals, just got some of the benefits here. It's got the Medicaid card on there as well. So these are really good to use, and a lot of times they'll be free as well, or little to no cost. Again, you can here's some bingo. People do bingo events. They try and get clients in and then sell them that way. I mean, whatever you're really trying to do, I mean, give us a call as marketers and we can tell you some good ideas. I'm going to show you some websites here for areas that you can get into that are low income and where you might find clients like this. Turn 65 list, things like that, we can get of low income. But like I said, we'll get to the leads a little bit later. Thank you cards. Unfortunately, I'm not the best with the computers. I couldn't make this as clear as I would like. You can kind of get the gist of it though with these. This is just following up afterwards, and the thank you cards after you write the business. Like I was saying, a lot of your client retention is going to have to do with after you write the application. You got to make sure you're on your client and make sure they're getting all the benefits that they qualify for and that they get on these special plans. So confirm the enrollment. Your client wants to watch out for the member ID card. Call your doctor and make an appointment. Call with any questions you have about the plans, and watch for healthy reminders. So this is something you can send out to the client. Like I said, this is the thank you card, and then you would kind of want to stay in their face and maybe a call each week in the first month after enrollment, and then maybe once a month after that is usually fine. But that you want to do, just like I said, so you make sure you're on them, and they're using the plan to the best of their benefits. I'll leave this slide up for a little bit. This is actually some of the websites you can use to get into some of those low-income areas or get an idea of where they are near you. So if you want to hopefully get some people who might qualify for it, you can go to affordable housing, free clinic directory, food pantries. These are all great areas that'll give you that, like I said, there will probably be people who are on assisted financial or living programs. So you can see if they, if you can see if they're on a dual SNP plan or they might be interested in it. And really what you're doing, and I think the way it's a lot easier to sell these is that you can go in and run a free consultation. And Cody here is actually going to run, as I briefly mentioned before, the benefitscheckup.org. You can actually go on there, and there's a bunch of different programs you can see. I think he's going to show you all the possible programs you can you can qualify for on there. But you're going in and seeing if you can help them any way you want. And then obviously, if you can get them on a dual SNP plan, it's even better. It's really a Medicare Advantage plan on steroids in terms of the benefits and all the added features you get on there. Here's some of the other things we use for leads in different areas. So this is actually just a slide I pull off our regular regular presentation we do. So some of these, not even specifically dual SNP products. So I mean, center of influences like churches, synagogues, chamber of commerce. Took me a while to get that one right. Mailings, radio shows, employer benefit groups, senior living facilities. They go hand in hand with the dual SNP thing. Same thing. You can go in low income areas, or if it's a low income county, you can go into senior living facilities there and talk to people, see if they qualify for anything that's going to save them money. We have a bunch of great mailings that actually have been working out really well. We have one that's just a direct 1,000-piece mailer, however many you want to do. And we've been getting anywhere from really, I think the lowest we got is maybe a 3.5% response rate on these mailings. They go for about $4.55. Talk to us though. We're always splitting the cost and co-oping on these different type of mailings. So give your marketers a call and they can fill you in more about it. But we target under a certain level of income, and we have a mailing piece directly for people on LIS and possibly full dual prospects. So you always want to kind of see what's going on, and there's different, like I said, different events you can hold. The carrier reps usually have different pharmacies you can go into in certain areas. Sometimes they get leads as well, so it's good to be in contact with them, and that's a good reason why you should be going to these the dual SNP trainings they're having in your area. Again, because it's more local, it's very state specific. It's not the same thing across the nation. And then also, like I said, you're getting their face. If they understand that you're trying to get dual SNP business and you're willing to work, whether it's some type of facility that you're in, or if you're just working leads, they have those resources in addition to us, and they can help kind of distribute those. So this is how you can find some SCPs, basically by seeing what type of levels your clients are going to be on. And this is the benefitscheckup.com. That's actually my mistake. It should be benefitscheckup.org. So if you want to write that down, Cody's going to take over here and actually go to the website and give you a live example of what it's going to be like to possibly run a prospect's information through there.
Thanks so much, James and Dustin. That was very informative. Once again, I'm Cody Johnson. I'm one of the senior sales directors here. I handle some of the southern states as well as the Northwest. So I'll be going over. I'll do a mock consultation. This is a underutilized website that'll let you see exactly what your prospective clients qualify for when it comes to extra help, help with food, transportation, you name it, pretty much we can find out. So it starts, like many of the websites in this industry, by the zip code. We'll go ahead and use a random Tennessee zip code that I know by heart. So we'll get started. Shelby County, Tennessee, which is the Memphis area. Who are you completing this for? So we'll go ahead and, for the sake of argument, we'll say self. In this case, we're going to be, we'll pretend this is a female. Women rule the world, so we'll go with that. We'll keep it 1952. So this would be someone who's Medicare eligible. And November is my birthday month, so we'll go with that. This is the household income, including spouse, anyone who lives in the house, and it goes by gross income. So we'll say someone is just living off of Miss Jones is living off of a modest Social Security check, and it's less than $1,000 per month. She is a single widow, and she's not a veteran. Ethnicity, we're going to go with Hispanic. And what do we want to learn about? So this is why I advise all the agents that I work with. We want to check off everything. Just say you're working with someone and they don't qualify for the plan that you want to write them. They won't qualify for extra help with anything relevant to a Medicare Advantage plan. But just say if you can help them find some assistance with housing, transportation, education. You never know. They'll love you for life, and you'll get a lot of referrals that way. So let's check off everything. Okay, then we will continue. No thanks, no email reminders right now. Okay, so this shows everything that we're interested in. Let's go ahead to complete your benefit support. We'll skip this. This is just extra information that they can apply for to have emailed to them. Okay, so are you currently receiving benefits from or participating in any of the following programs? This person is Miss Jones is on Medicare. She is a citizen, and she has a prescription drug plan. And how do we learn about this site? Google. We learn about everything from Google these days, right? Are you and your spouse or former spouse U.S. military retiree? We're going to say no. Do you take any medications? Yes, Ms. Jones does. So we're going to enter in a random drug. Let's do Advair. She uses an inhaler. So we'll add that to the list. If you had an eye exam, so on and so forth. This is something that you can go into detail about, but we're just going to leave them no for the sake of argument. What type of housing does Miss Jones live? She owns a small rancher in Memphis. She lives alone, no dependents. She does pay property tax, and she pays her own bills. This is going to ask some question about how much your prospect spends monthly on said items, whether it's rent. Cost of living is a little low down there. Let's do mortgage. We did say she owned a home. Her mortgage is $400 a month. It'll ask about electric, gas, water, etc. We'll just leave that blank, but this will be some factors that you want to enter when you're doing a real case. Okay. Asks is she collecting from a pension, SSI, Social Security. So we said she has a small Social Security income. Okay, let's say it's $700. Okay. This is asking about the assets of the prospect. We'll go ahead and move past that for the sake of time. Voila. So at the very end of this, it'll tell you what your prospect qualifies for. Help with medications, health care. In this instance, Miss Jones qualifies for a ton of help. And you can go ahead and print what she qualifies for, which is really good. So let's go back to results. So once you scroll down or click on, it's going to let you view what she qualifies for and also how to apply. So it'll give you instructions on how to go ahead and fill out an online application for said help, whether it's help with prescription drugs, which she qualifies for, and it gives you each of the programs, as far as medication help, healthcare, Medicaid, or TennCare, which is Medicaid's is branded in Tennessee, the Medicare Savings Program, iCare, America's Online Referral Center. So you can go ahead and help them apply for this assistance right there on the spot. Typically, depending on which program it is, anywhere from 7 to 14 days it takes for them to get accepted, for extra help with drugs, Medicaid, etc. So in that instance, you can go ahead, change their life by helping them apply for Medicaid or LIS or the Medicare Savings Program. And then in 14 days, schedule a time to come back, write them a plan that fits their needs. So once again, this is benefitscheckup.org. If you have not written this down, please do so now. This is going to be one of your best friends when it comes to helping to see if people qualify for a Medicare Advantage plan or special needs plan during the off season when it's not a typical enrollment period, such as AEP or OEP, which I'm sure a lot of you guys know is coming back. It's coming January. As James touched on, Dustin as well, we have a ton of lead programs that are dual eligible specific. Please give us a call. Call us. If it's not one of us who work your territory, we will put you in the right direction. We'll hook you up with the sales director in charge of your area. We'll go over our lead programs, some of the more intricate tools that we have that are going to help you write dual eligibles and much more. Of course, that's not all we do. Medicare supplements, we have a huge life and annuity department. If you have any questions on that, just give us a call. We'll get you set up and contracted with the carriers that you need, and you'll have access to our lead programs, our online enrollment tool, which is pretty exclusive to us. Feel free to give us a call, and we'll be sure to help you out. I'm going to give it about 30 seconds to see if we have any questions pop up. Bob in Virginia wants to know if we have any mailers specific to the dual market. That's a very good question. We do. We actually have multiple mailer programs which we mail the dual population specifically. Some of the criteria we use, of course, is income level. We'll mail a specific area, and actually they have pieces that cater to the dual population. So that's a very good question. And yeah, give us a call. We'll be happy to go into details as far as pricing and your different options as far as those mailers are concerned. Okay. Another question: will copies of these slides be made available? This webinar, we can email it to you for absolute sure. So like I said, just call in. Sales director will get this over to you. So it's something that you'll have as a reference piece. Okay. Bill in Washington, he's up. Oh, it's 8:30 there. He got up early. Thanks so much for joining us. I know it's early over there for you. Medicare supplements, yes, as I said, we do. We pretty much have all the Medicare supplement carriers that are relevant that you would need. So that's something you can call in. We'll go over the carriers that are good over there in your area, and we'll be able to set you up with that. So just give us a call. Today we're here all day, and we'll take good care of you. I have another good question. As far as the benefitscheckup.org, if you're actually doing a real life application for a client, do you have to set up a login? Yes, you will. You'll have to set up a login on the said site, not on benefitscheckup.org, but once it redirects you to the site that you're exploring, whether it's whatever state funded site that it redirects you to their specific application, you'll have to set up a login for your client on that site. But not for benefitscheckup.org itself, if that makes it any sense. But if you get as far as to actually filling out an application for one of these programs, that particular site will definitely make you create a login, which of course only takes a couple of minutes. So, and if you're dealing with a client that some of them don't have access to email, you can create one form or use one that you have access to. But yeah, you'll once you get that far, then you will create a login for them. I have a question. I'm going to try to navigate and make some sense of it. Someone's asking what this business will cost them. Well, if you're asking how much it costs to work with Pinnacle, it won't cost you anything but your time. There's no small writing. There's no appointment fees as far as working with us as a broker. If you're asking how much it will cost for access to certain lead programs, they vary, whether it's a mailer, preset appointments, internet leads. This site, if you're asking if benefits access to the site, it doesn't cost anything. So if I didn't cover the exact nature of your question, give us a call and we'll be happy to go into more detail and get to the bottom of it. Okay. We'll give it 20 more seconds. I think the questions may have dwindled down. One more, a very good question. Do you have to be 65 and over to qualify for a dual plan? That's a very, very good question. Actually, no, there is an exception to that. If someone has been disabled for 2 years, 24 months after they qualify for disability, they then automatically qualify for Medicare. So if they're Medicare and Medicaid eligible and they're under 65 but disabled for at least 24 months, then they would qualify for a dual plan as well. So yeah, there's some nuances of some variables that can affect who's eligible, and we're always here to go ahead and assist. We don't care if you're in the house and you have questions, you'll be able to get a hold of one of us and we'll walk you through, answer any questions so you can take good care of that client. Very good question. One more. Do we work the ACA market? No, we actually don't. That's not a big part of what we do as far as the ACA stuff. We cater more so to the senior community when it comes to the actual health insurance plans. They're going to be Medicare eligibles, but we can definitely refer you to one of our agencies in your area that specialize in those plans and keep it all in the family and make sure you have what you need. All righty. Thanks so much, everyone, for tuning in, sharing your time with us. You guys were a great audience. We look forward to hearing to those of you who have any questions. We love to work with you guys. We have a ton of value adds. We'll be happy to go over with what separates us from the other FMOs, IMOs, or whatever they're calling themselves this week. So give us a call, and thanks so much for joining us. And for myself, Dustin, and James, we'll talk to you soon.